Global Leaders series. This series is done in partnership with SGV. Thank you very much to all the SGV here. And our media partners, ANC, BusinessMirror, and Business World. Thank you to everybody who made it here to the hotel today. And of course, thank you as well to those who are joining us by Zoom. For those of you on Zoom who are willing to turn on your cameras and wave at us, I'll give you a couple of seconds to do that. Turn on your cameras. Anyone? Oops, we lost them all. That's me. Cameras of Zoom, there, one. Hi, Arlene. Anyone else? So thanks for joining us, if you're joining us by Zoom. And before we begin, let me acknowledge the presence of some of our board members here today. Ambassador Jose Quisha and Dr. Aris Alip. I'd also like to acknowledge, and I'll apologize, Ambassador, I haven't memorized your name. The Ambassador of Nigeria joins us as well this morning. Thanks again for joining us. There are about 100 million Filipinos in the country. There are several millions more outside the country. They send home the ones outside the country, many of them doctors, nurses, caregivers, send home about 10% of our GDP. Between that big population and that OFW money coming in, the Philippines can continue growing for a long time. But decade after decade, we see ourselves being passed by neighbor after neighbor. And we all want to put the Philippines on a higher growth phase and to create more and better jobs for Filipinos. To do that, we believe at MBC that Filipino businessmen and executives need to think, act, and compete differently. We can't be doing the same thing and expect a different result. We should be thinking, acting, and competing more globally. And that's the inspiration, really, for the Global Leaders series. We need to run our companies like the best companies in the world, use the best technologies from around the world, and then sell to the world, not just to ourselves. That's our inspiration for the series, to help Philippine executives such as yourselves think, act, and compete more globally by giving them the opportunity to meet, talk, and gain insight from global leaders such as our guest today. We started this series in 2019. We pursued it in different ways during the pandemic, including a podcast. And we start our post-pandemic run today. We are proud and honored to do so with an exceptional leader, Dr. Margaret-Mary Wilson, EVP and Chief Medical Officer at UnitedHealth. Vivian will introduce her more properly later on. But suffice to say, UnitedHealth is one of the biggest healthcare companies in the world and the biggest in the United States. MBC is very proud and honored that the Global Leaders series is sponsored by SGV. Most people in this room know that SGV is the biggest accounting firm in the country. Not many probably know that SGV is one of the original Filipino global companies. As early as the 60s, they were forming branches and alliances around Asia in countries like Taiwan, Thailand, Indonesia, and Vietnam. And so they're a very fitting partner for this series. To properly introduce our speaker today, I would therefore like to call on SGV Vice Chair and Deputy Managing Partner Vivian Ruiz. In keeping with our global theme, Vivian wears a global hat at EY. EY is the global network that SGV is a part of. Vivian is the lead, the regional lead for assurance at EY. Ladies and gentlemen, Vivian Ruiz.
Thank you, Coco. Good afternoon, everyone. I'm delighted to welcome you all to the first session of the Global Leader series. And this series really aims to uplift the lives of Filipinos by capitalizing on the different sectors that the worldwide offers to us. This is also a way of introducing the global leaders to our local business leaders. It's a way of interacting and interfacing with them. And we are focusing on various fields such as finance, technology, and for today, healthcare. As we all know, the COVID-19 took the world by storm. and the healthcare companies took a pivotal role in navigating through this worldwide crisis. So this event for this afternoon, we will hear about excellent leadership during and post-pandemic. Our esteemed speaker for today is Dr. Margaret-Mary Wilson. She is the Executive Vice President and Chief Medical Officer of the UnitedHealth Group, one of the biggest healthcare companies in the United States. She continuously advances the company's clinical innovations to develop a robust and inclusive health system for patients and providers. She is an exceptional leader that steered her organization through one of the world's most disruptive events in the world. On top of this, Dr. Wilson has a very inspiring and impressive background as a staunch advocate for diversity and inclusivity. We are privileged to have her here today to share some valuable lessons on crisis management and leadership. A bit of background about Dr. Wilson. She was born and raised in Nigeria. She often talks about how her mother doesn't know how to read or write. And that's a sign how probable it was for a very young Margaret-Mary. But she always listens to her mother that says, and who has always told her she could do anything she set her mind to. And so she did. She got her medical degree in Nigeria, made her way to UK, and then made her way to the US. She joined UnitedHealth in 2008 and steadily rose in the organization until she took over the Chief Medical Officer post in late 2021 in the middle of the pandemic. How big is the job? It's really a big job. UnitedHealth serves 8 million Americans in 50 states and 130 countries. It has a workforce of 300,000, over 300,000. And of course, not all of them are under Dr. Wilson, but it's a healthcare company, but I'm sure most of them are. As a manager and a leader, one of her priorities is also diversity. This is not just about women. Dr. Wilson is also a leader in the LGBTQ and African American communities. We look forward to hearing a wealth of insights from her today. So on behalf of the fellow MBC members, I would like to thank Dr. Wilson for joining us this afternoon. Thank you everyone for joining us in this event. I hope this is one of the many occasions where MBC can facilitate the sharing of knowledge and experience with really the goal of strengthening and advancing our country's socio-economic development. So please join me in welcoming Dr. Margaret-Mary.
Thank you so much. First of all, let me say thank you. Thank you for giving me the opportunity to speak with you today. It's an absolute honor, and it's an absolute joy to be in this beautiful country. The first time I was here, this is my second visit, was actually in 2016. I was with United Healthcare then, and the conversation during that visit was how we could work together to build out our evidence-based clinical care models. That was 2016. And so when I think about the fact that I'm back, probably about 7 years later, and we're talking about leading an organization through a healthcare crisis, that's such an honor and very humbling, because I don't know that I have the answers. I am grateful that we all made it through the pandemic, and what I'm hoping that will emerge from the conversation we have today are learnings and lessons that we can all carry forward. Because if there's one thing we learnt during the pandemic, the world became a very small place, and we all became interdependent. We must all be interdependent to be sustainable. So I'm going to keep my comments short and just set it up for the conversation that we're going to have in a few minutes. I remember as a young doctor in Africa, in Nigeria, I was in my early 20s, very early 20s. And some of you may remember there was a yellow fever epidemic. And I remember turning up to the hospital, this was UCH Ibadan. We had no vaccines. For some reason, they hadn't come through the World Health Organization. And yet patients were coming in with yellow fever in the emergency room. Many were dying. And I remember a professor of medicine said to us, he assembled the younger doctors and said, you have a choice. We have no vaccines. We barely have enough protective equipment. So you can leave if you want to. I'm not going to force you to stay. And I remember we were a few doctors there, but probably about 10, young, early 20s. We looked at each other, and the question we had for ourselves was, if we left, who would help the patients? I always prayed that I would never be involved in another pandemic like that. And then COVID. And when COVID struck, that's what I remembered. By way of background, I'm a physician. I trained in Nigeria, the UK, the US. My specialties are internal medicine, cardiology, and geriatrics. My journey carried me across the world, 3 different continents, into academic medicine in the United States, where I was on faculty at St. Louis University. And the interesting thing was that I got to the point in my career where the outcomes of care in Africa, UK, and the US all felt the same, even though they were 3 entirely different continents. And you would think that the more resources you had, the better the outcomes, but I wasn't seeing that. And it was at that point in time I decided I would take a step away from academic medicine. UnitedHealth asked if I wanted to join the company, and I joined in 2008. And it was with the UnitedHealth Group that I began to find the answers, the same answers I see playing out in Optum here today. 2008, I was a medical director. I became senior medical director, then regional vice president in the US. And in 2015, I had the honor of being asked to become chief medical officer of UnitedHealth Global, brought me out to the Philippines the first time, and it was all going fine and dandy, and then COVID struck. And it was in the middle of COVID that I was also then, a year in, asked to take the position as Chief Medical Officer for UnitedHealth Group. I will say, as we enter into the conversation shortly, one of the things that we've emerged from the pandemic with, and how I'm hoping I can help frame up the conversation, is that a big focus for us at UnitedHealth Group is really clinical integrity. We consider our clinical focus to be the conscience of the enterprise. That is really what we're about, our simple mission, helping people live healthier lives and helping healthcare systems work better for everyone. Our focus is on clinical quality and patient safety. We saw how important that was during COVID. Second area of focus clinically is really around how we begin to build clinical leaders for the future. Third priority is how do we modernize and transform healthcare. And the fourth is how do we use our voice to really speak in a way that we are able to impact the lives of people regardless of what country they might be situated in. So I think at this point in time I'm going to pause here, and hopefully we can enter into the conversation with this grounding. Thank you. Great.
Thank you very much, Doctor. We have about 30 minutes or so for discussion. I have a few questions to start with, but really hope most of the questions come from you. We've intentionally kept this very small. Thank you very much for joining us, so that there's a better chance for all of you, or any of you, to raise your hands and ask a question. And you're also very close, so it's not you don't need to be shy raising your hand at the back of the room. Doctor, thank you very much for joining us. A few initial questions, maybe. You trained as an internist. I think as you said, your specialization was geriatrics. Then you also taught Do you miss any of that now that you're running an organization rather than treating patients?
Do I miss being at the bedside and caring for patients one-on-one? Absolutely. Absolutely. Those were some of the most rewarding years of my life. I am grateful that I experienced that. I am also grateful that I then got a higher calling, because I consider it a higher calling. As I shared when I was speaking, I got to a point where I wanted to be able to help make a bigger impact. And so as dear to my heart as it was seeing patients one-to-one, when I got the opportunity to work with a healthcare system where I could now begin to impact systems, communities, work with leaders in states, in countries, to help make the lives of millions of people better, an exponential impact, it's truly humbling to be part of that effort.
We have many participants here who are from the healthcare sector. I'd like to ask first, do we have any doctors in the room? That's a phrase you usually shout in a plane. Are there any doctors in the room? None? How many healthcare industry? Okay, maybe about 10 in the healthcare industry. You talked about how you decided to move on from the teaching job to UnitedHealth, which had an offer at that time, because you saw that that it was the same from continent to continent. Could you elaborate on that?
So if you think about Nigeria, which is where I trained and practiced and also taught medicine as a senior resident, we had very few resources, not a lot of money. And so, as you can imagine, people didn't get the care that they needed and very often died of things they didn't need to die of. So then I moved to the United Kingdom because I thought they had to be better. And what you see and what I saw in the United Kingdom then was the effect of regulatory constraints, where regulatory constraints and formulary constraints are implemented without truly attending to the unintended consequence or the voice of the patient. You simply set up another choke point for access, right? So the outcomes can be impacted there. Also, then I moved to the United States where there was actually overutilization of care and health disparities, health inequities, stratifying society. So there again, you have a lot of waste, disparities in care, and so the outcomes for some are almost just as bad as they were in Africa.
So hard to believe, huh?
It is, and that's really why one of the areas I'm really passionate about, regardless of country, is health equity. Because we should all be able to have access to affordable, quality, safe, and accessible care.
And so is the solution to the fact that no matter whether you're in Nigeria, the UK, or the US, in some way the outcome is the same, are you saying that the solution is to join a private company that can make a difference? This is a captive audience here.
No, I wish it was that simple, and actually that would be the wrong approach. I'll tell you what I think the solution is. One, the solution is local, right? No one can build a healthcare ecosystem for anyone else. Forget countries, even on an individual level. I cannot create your healthcare ecosystem. I cannot tell you what it is. It's got to be unique to you. So first, it's got to be local. Second, it's got to drive value for you. And so when we bring those two things together, local, driving value for the person, for the family, we begin to ground that in a way where it will drive access to care, it will drive good outcomes, and it will be affordable. And so it moves away from whether this is public sector, private sector, academic practice. It moves to where it needs to live. Health is life, and it needs to live with the person. So that is really the approach that, and I think for the pandemic, also showed us that we truly needed to begin to view health differently?
I don't want to leave the healthcare topic at all or yet, but my next question maybe can be applied to any business. You're essentially saying, in some way, it's got to be customer-centric. How does one do that in a large organization with as many clients and customers that you have?
So when we think about size, one of the challenges for any large organization, if you just focus on magnitude, is that one tends to become inflexible and rigid. So the key to achieving the goal that you brought up cannot be size. It really has to be in how do we think about models that are agile, dynamic, and flexible. Size, right, dynamic, agile, and flexible, and how do we think about the capabilities and the skill sets we have and then bring them together intelligently in a way that helps truly drive an impact? Size comes in when we think of, and it's helpful when we think of avenues through which we can scale best practices, avenues through which we can test hypothesis or test pilots. That's really where that comes into play. But we've certainly moved really far away from thinking of, organizations or industries simply through the lens of size or magnitude.
In your day, in a typical day, how much of your thinking and decision making is still medical, and how much of it is just management?
Tests of leadership, right? One of the things that I have learned in my journey is that as I took on more leadership responsibilities in order to be effective, what was really being asked of me was not how good of a doctor could I be. There are doctors all over the world who are much better than I can ever be. What was really being asked of me was, how could I help lead? What's being asked of me is not how well I can manage a team. There are managers who can do a much better job than I can. Leadership I am learning is different. And in the positions where we all sit, it's really about leadership for all of us. And that for me continues to be a learning journey. And sometimes I ask myself, is it really about leadership, or is it about the ability to follow, inspire, and lead from behind?
I'm going to guess you're going to say it's more about following from behind.
I think it's more about knowing when to flex which leadership muscle. And that's the magic of the recipe.
So you said this is a learning experience for you. Could you tell us what was what learning experience or what learning really sticks to you? It may have come during COVID about leadership.
I think many lessons, right? I wish there was just one, but there are many lessons, and I continue to learn. I will share a couple that really resonate with me. When I was much younger, I'm sure like many of us, and I talk about decades ago, I thought about a leader. You think about someone who's sort of strong and powerful and knows it all. And interestingly enough, when I got to the point where I was seen as a leader, emerging or otherwise, I learned that it's really about, one, humility. This is what I tend to lean into. I find gives me strength as a leader. The humility and the ability to listen to my team. The ability to recognize that I don't have all the answers and no one expects me to have all the answers either. To learn from others. As a leader, what I find helpful is being authentic and also being vulnerable. And also creating an environment for my team and others, really important. And this I learned during the pandemic. It helped to reinforce that. The environment has got to be psychologically safe. And here's what I mean. During the pandemic, faced with COVID, the reality is that very few of us could say we actually knew what was going on. It's a new virus. We didn't know which way it was going to go half the time, and yet leading organizations, our teams looked to us for the answers. Innovation was key. We had to think of new and creative ways to solve problems. So when you think about innovating in an environment that's ambiguous, uncertain outcomes, people have got to be willing to fail. And I found one of the key elements as a leader was being able to create an environment of psychological safety where people did not fear failure, where people recognize that in order, I have come to learn, to be a successful leader, I have had to fail, not once, but multiple times.
My favorite quote along that line is the person who's just failed in a company goes up to his boss and says, I'm going to resign. And the boss says, I've just paid your tuition. Why are you going to resign now? I'm going to open it up to questions. I hope there are many in the room. I'm going to go first here to an alumna of the group, at least. Could you introduce yourself and then go to the question? Bianca will come to you with a mic.
So nice to have you here, Dr. Wilson. Yes, and I'm an alumni. I used to work for UnitedHealth Group, and very proud to have worked for the team. So, the Philippines, I know it's an important cog in the whole system at UHG and Optum, etc. But from a worldwide perspective, given also the focus, not just in the US on Philippine nurses, but at King Charles III's coronation, where we saw a couple of Filipino nurses right there in the front row because they're part of the NHS. What role do you see the Philippines playing in healthcare?
Thank you.
I know it's very broad, but hopefully you have some nuggets of wisdom for us. Thank you.
So thank you. So I'm an international medical graduate myself, right? International when it comes to US. And I will tell you in the course of my education, all the way from when I was in high school, studying the sciences, getting ready to go to medical school, I will tell you that when I think science, and not just me, but many across the world, science, healthcare, the Philippines plays a central role in that, with really strong and robust talent. And that's unquestionable. So when we think of high-performing clinical talent, globally, one of the countries that comes into the conversation is the Philippines. And I like to share with people that when we think about talent, it's not always necessarily a function of technology, right? There is something to be said for professional talent, which you cannot replace by technology. So why do I say all this? I say all this to say, globally we are facing a healthcare workforce shortage of talent. Globally, the challenge for all of us is how do we build out our healthcare workforce? How do we innovate in the clinical workforce space? It's not a question for a single country, because no single country will come up with the answer. It's a question for us all. The solutions will be local. They will have to be culturally relevant. And no country is going to get there without thinking of how do we partner from the thought leadership standpoint to really help advance the discussion. So that's really the way I would respond to that.
Thanks very much. More questions? Yes. I'll just give you a mic. Please introduce yourself.
Hello, good afternoon, everyone. I'm really glad, Dr. Wilson, that you're here. I'm Julie Atendido. I'm from Accenture. I actually lead the health industry for technology here in the Philippines. So I'm really excited to be here today. My question is, so since we're talking about the pandemic, right? we've been seeing a lot of convergence of healthcare with other industries as well, like retail, financial services, and all the like. And health equity is very close to my heart. Care management for patients is very close to my heart because day by day, I think, how can we use technology to address situations like shortages of medical practitioners, right? So what would you advise business leaders like in other industry sectors who have started embracing healthcare into their industry and for us to be able to provide an efficient care management to our patients?
So there are two ways I would answer that. I was actually at a meeting in Chicago recently. Interestingly enough, it was the Chicago CEOs, so a similar meeting, just Chicago. And the one message that resonated with me about that meeting was that there was a constant reminder that healthcare is no longer just about hospitals and doctors and nurses. This is healthcare. We're all in healthcare, whether we like it or not, because health is life. So that's recognition of that and understanding that if health is life, our health ecosystem is what we're in right now. It is our collective accountability. That's the first. And then I think the second thing, and this is where you see the confluence between healthcare, digitalization, technology, the voice of the consumer. The voice of the consumer. That's really where the focus needs to be. And understanding that the voice of the consumer is not a solitary, homogeneous voice in the wilderness. You have the generational play, you have the cultural play. This is where health equity comes in. How do you listen to so many different voices at the same time? What is the quickest way? How do you flex with multiple different solutions? And it's in that space that healthcare, digitalization, technology, artificial intelligence, humanization, it's in that space that they all must coexist. The challenge ahead for all of us is pretty significant. I often say, if we were to fast forward 10 years ahead and look back at healthcare, we wouldn't recognize it. The doctors, the nurses, decades forward are going to be very different from what they are today. Healthcare delivery settings are going to be really different from what they are today. That is the space. That's how we need to be thinking about leveraging digital technology. It really must be about the consumer and how we bring healthcare to the consumer as opposed to expecting the consumer to go out and look for healthcare.
I saw a news report, I'm sure it just came from Japan, where they had some robot that could treat, I think it was targeted, it happened to be targeted, I think, to geriatric patients. I think maybe because the treatment was relatively standard. And that's how the healthcare went to, as you said, went to the customer. I'm not sure if that's what you meant, but that's what I saw. Is that we're going to see a lot more bots and robots?
If you think about it, there is a lot of redundancy in healthcare processes, which drive a lot of waste. And when you actually stand back and look at our systems, the problem with access in healthcare is really because our processes are bureaucratic and unnecessarily complex. Many of the steps in our process can actually be automated. We're seeing that now. It can actually be pulled out. So yes, the answer is a lot of that can probably be managed. There's always going to be the top of the license play and keeping it human, and that's where it gets tricky.
So you said if from 10 years forward, you look back to now, we wouldn't recognize healthcare, or we'd wonder, why were we doing it that way?
Correct.
I'll ask you, if you look back 10 years from now, 10 years ago, what kinds of practices did either the healthcare system in general or UnitedHealth do in particular that you would now laugh at or wonder why you did it that way?
I think the biggest one that would resonate with a lot of us in this room is the amount of care that we delivered in hospital 10 years ago, which we don't need to deliver in hospital. 10 years ago, there were patients with heart attacks who were being admitted for weeks and asked to lie flat on their back in bed. Today, you don't. Hip knee replacements. Many of those are being done as outpatients. So there's a lot of what we see recently, even our requests in terms of care management, prior authorization, the steps that people had to go through to get care covered. You're seeing liberalization of that. So gradual steps, but I think that will continue.
Thanks very much. Question from this side. Eileen is the head of IBM in the Philippines. She's also the head of MBC's diversity committee and project.
Thank you for introducing me.
I know you're humble, so I had to make sure to do it for you.
Thank you, thank you. So, Dr. Wilson, it's probably a leadership question, not a medical healthcare question. So many of us here have been through the pandemic, and I'd say COVID was really a great equalizer for us. We all, it resonated to me when you said that the humility was a very key one as a leader that you tend to really have to hone now. And being dynamic, agile, flexible. It's much easier said than done, right? We all built some new leadership muscle to handle the uncertainty, the crisis management that, many got shocked about. What do you think would be a leadership muscle? If there's one or two things that would be new leadership muscles we all need to be prepared about moving forward, whether there's a new pandemic or as leaders, of our companies and, as executives, what would be your advice? Thank you.
I would say if I were to pick one, I would say the leadership muscle that we all, at least for me, was developed, was comfort with ambiguity. That in my mind would be the one leadership muscle that I think was thoroughly stretched, comfort with ambiguity. I think the second, if I were to pick, would be authenticity. The pandemic did so much to bring out authentic leadership in people that hitherto had been somewhat suppressed by corporate constraints. And what I was able to witness in myself and in others was the value of authenticity on innovation, ideation, inclusion. It was just incredible. So I would go for those two. I think we all built that muscle in different ways.
Could I follow up on that? You are a leader in diversity. And we've all heard why that's important. Could you give us a concrete example of how it played out in your experience, where diversity mattered, where diversity made a difference?
So when I hear you say example, I hear you ask for an example beyond the data, right? Because when you look at the data clearly shows that in healthcare, people who look like, share characteristics of the group, as healthcare providers, their patients will have better outcomes. We see that. We see a strong case for diversity when you actually look at successful businesses. Businesses who are more profitable tend to be businesses that have a stronger emphasis on diversity, right? So the business case is there, the outcomes are there, quality and cost covered. Now, let's go back to the pandemic. One of the things that we saw during the pandemic was the way innovation was thwarted if one did not consider diversity. So homogeneous solutions implemented in communities were bound to fail. So you see that playing out there. But I will end my example with a personal example. I have asthma. And about 8 years ago, I was admitted to a hospital in New York with an acute asthma attack. Being a doctor, I was lying in the emergency room in a cubicle, there are patients around me, expecting the treatment, which is usually for those who have asthma, the mask with the medication you breathe in. And as I was lying there, a nurse grabbed my hand, and I saw her about to inject me with a needle. And so I knew that there was something wrong. And so I said, "No, why are you doing that?" And she said to me, "It's for your withdrawal symptoms." And I said, "What do you mean withdrawal symptoms?" And she's like, "Well, this is what happens when you are on drugs." And I was like panting because I was short of breath, and I'm very confused. As it turns out, another nurse had said to her, go give this medication to the patient in the cubicle in withdrawal. She walked in, there were two of us there. One of them was a white man, and the other was me. And she made the assumption. I give that example to say, when we think about diversity, before we even get there, let's think about unconscious bias. There is bias in us individually, there's bias in our systems, there's bias in our processes, there's bias in our institutions, there's bias in our businesses. So if we're really going to get to the point where it's not about pointing fingers at people, but truly taking on institutional bias, we've got to recognize that diversity of thought is important. Because I will end by saying, when we talk about diversity, I often say, it's not about a cosmetic arrangement. We have 5 men, 5 women, 5 white, 5... No, it doesn't work like that. The whole point of diversity is to get to the point where we think differently and we harness our collective power of thought.
That's a powerful example and a powerful conclusion to come from it. Thanks very much. Question over here. Please introduce yourself. So far, we've had one question per table, so we'll come back to this table.
Good afternoon. Welcome, Dr. Wilson, to Manila. In your opening...
Please introduce yourself.
My name is Deo Orpilla. I am Chief Business Development Officer for Sun Life of Canada. My question, Dr. Wilson, is, in your opening statement, you mentioned that one of your passion is equitable access to healthcare. I believe it's one of our biggest issue in this country. Every time a Filipino gets sick, 55% of the cost is out of pocket. So it's a real issue on access. You're a trained doctor, and you are a global executive. From the lens of your view from the African healthcare system, and you've been exposed as well to the European healthcare system in the US, what would be your advice to business leaders in this room on how we Filipinos can improve our healthcare system, specifically on the subject of delivery and equitable access?
So thank you for that question. It might strike you as strange if my first response is, I don't know. And I'll tell you why my first response to that question in any country would be, I don't know. And that's because in order to answer your question first has got to be data analytics. And that's a step that's often overlooked. Understanding the terrain, truly leveraging sophisticated data analytics to understand the opportunities, the gaps, and the disparities. That's one. I would say when you look across any country, the Philippines, the UK, Africa, the US, it always comes down to access. That's the choke point that everything converges on. And so, as one seeks to understand the data-driven disparities, the second that's important that often constrains access is waste. How much waste is there in the system? And then the third piece is really where health equity comes in, understanding the factors that play into that. It is rare that when one takes the time, be it a system, a community, to truly leverage data, to understand data-driven insights, it is rare that one will step away without being able to identify the major drivers that impact access. And then once that is done, culturally relevant local solutions tailored to those gaps is the second way to go. Very often we kind of do it backwards, rough guess of what we think are the drivers, and then we mount these huge efforts to manage it, and that's where sometimes the results are suboptimal.
Thanks very much. Ambassador?
Thank you, Dr. Wilson, for your very interesting presentation. As I was explaining to you earlier, Film Life Insurance and United Healthcare had a very, I would say, successful, very profitable business partnership in a company called Film Care, which was the largest HMO from the mid-90s to around 2008. So we had a very successful, very rewarding partnership with United Healthcare. Unfortunately, when AIG, parent company of Film Life, ran into problems in the US, we were required by our parent company to dispose of Film Care. And of course, we had to, an agreement with United Healthcare that we would sell anytime together we would sell, so we'd get a better price. So it was unfortunate. I thought it was unfortunate for the Philippines to lose such a good partner in United Healthcare, because I felt that the contributions of United Healthcare to our healthcare system were very valuable at that time, especially when it came to clinical guidelines, treatment, and so on. Our operations people were very happy with the guidance that we would get from United Healthcare. My question is, I know that you have shared services here in the Philippines, but is there any possibility that United Healthcare could be invited back to be more involved in the healthcare, I'd say healthcare business in the Philippines, because the opportunities here are very attractive, and the fact that you are the largest healthcare group in the US, I was wondering whether there is a possibility that we could interest United Health to come back to the Philippines and be more active, either through partnerships or through your own standalone operations in the Philippines, aside from your shared services operation. Thank you.
Thank you so much, Ambassador, for the question. And thank you for your favorable comments about the business, really, about United Health Group. Really appreciate that. You know, I often like to lean into my role as Chief Medical Officer for United Health Group. And so questions directly related to the business and growth are, as you can imagine, outside my expertise. I do, outside my area of scope. I do say, though, what resonated with me about your comments was the criticality of evidence-based standards when it comes to clinical care. And, you know, I started as part of my comments, I talked about the fact that part of my role is really around driving clinical integrity. And so I come back to my earlier comments about how we think about healthcare ecosystems regardless of the stakeholders. And I think at the core of it, where I often lean in and encourage engagement is really around how do we think about conduits to transfer best practices across communities, across countries, you know, regardless of business models. So I would say, as I think about the way forward, I still think in terms of clinical integrity and how do we share that, because I think that that really is the framework moving forward.
Thanks very much. Chris, wow. Okay, Chris first, and then, yeah. We have 4 questions to go. Please keep it quick, because we need to wrap up soon. But go ahead, Chris.
Curious, in your travels, have you seen ways to approach the provision of healthcare that could be much more affordable to get to that point of equity? Different kinds of models that might lower the cost of service or delivery, because the reality is we're in a country with relatively low purchasing power, a government that has limited resources as well, limited insurance. And so I love the idea of the equity, but how do you get there when you do have to figure out a sustainable model by which to deliver it? Things that you've seen that could chip away at that problem?
Thank you. Thank you for the question. I would first of all say no one country has the solution, but there are different components. I very often think about what those would be like if collectively we tried to pull them through. The first is locally driven models that center around the person. That's the first. The second are models that mitigate against waste, particularly when you think about workforce, where you have healthcare professionals working at the very top of their license. You pull waste out, and you have people doing appropriate tasks for their certification. So in other words, you're not leveraging cardiothoracic surgeons, for example, to treat chest pain, right? So that sort of model. So that's the workforce consideration. And then the third is flexible, agile, virtual. And then the fourth are models that lean into digitalization and technology. And so you think about all those four pieces. No one country has them all together. But I think that, and again, that's why I often talk about transferring best practices, cross-cultural exchange of information, because no one country is ever going to be able to come forward with this answer.
Thanks very much. This table.
Dr. Wilson, I'm very inspired of you. I'm Jai Karinan, the Executive Director of Philippine Financial and Inter-Industry Pride. We are a nonprofit and also a business association that push for LGBT workplace inclusion. No? So earlier you spoke about psychological safety, and that is really driven from the top. No, it's you need to shadow that to the rest of the organization. And as a global leader, someone who's raised from Africa, you've been to the US and to the UK. Can you share to the group what is the function and what would be the impact of leaders such as yourself in driving a culture of inclusion for your employees and even for your customers, for our healthcare system, and to your stakeholders?
Thank you for your question. You are right. I'm a woman, an African immigrant. I'm also a lesbian, right? Legally married to my wife, who incidentally is also Nigerian. And I'm a leader. The journey to where I am today has not been without bigotry, prejudice, ignorance, lack of understanding, intended, unintended. But what I have learned in my journey, and what I also benefited from in my journey, is the power of visibility. And so for me, it's important as a leader, for others in my team and beyond, partners, consumers, clients, to be able to see me. Because when they see me, then they see all the status groups that I represent. And it all becomes so much less frightening. And so what I say to leaders, we are all different. We all have different status groups. The power of visibility and authenticity, I think, is what I would advise. Because if you do that, then that's a significant part of the problem solved.
Thanks very much. Question from here, and then the last one will be there. Here first. You're the last.
Hi, I'm John Nichols from PayPal Philippines. And also, one of my advocacies is working with a charity that looks at the ultra-poor communities. So those are the communities which in the Philippines, pre-COVID, was about 7 million people, now several million more. And when we talk about ultra-poor, these are the people who are on less than 20 pesos per mouth per head, which is less than 50 US cents per mouth per day. So the poorest of the very poor. And you know, the introduction suggested your upbringing is probably from similar roots, judging by, you know, you mentioned your mum was illiterate. So thinking back to you as your younger self, what is your advice to your younger self and to others in a similar position to be able to help them get out of that eternal cycle of poverty and be able to spin out? And, you know, how does the Philippines itself get itself out of that cycle?
Thank you for that question. And you are right. By virtue of my upbringing, interestingly enough, my father was wealthy, my mother was not. My parents separated when I was 7, grew up with my mother. So it was an almost immediate flip overnight from a higher economic group, socioeconomic group, to a much lower one. So you are correct. Here's what I would say. Again, it ties to my response about the power of visibility. It is important that we hold out hope. That is where, when we have these workforce development discussions, a lot of that comes into play. And one of the things you might be aware, recently at UnitedHealth Group, we committed $100 million over the next 10 years to expand diversity in the workforce. And as part of diversity, we also have socioeconomic diversity. So the key there is to actually, people cannot become what they do not see. And so that has to be part of the development experience. How do we introduce these experiences in a way that they are visible to communities where they may not see any of these role models around them, or may not even believe any of these opportunities are real? Of course, we almost must recognize the, Maslow's hierarchy of needs. And catering to the basic needs are key, but once you get beyond that, then it's really a question of how do we help support self-actualization? And that's where I think the DEI work also comes in and is important.
Thanks very much. Last question here.
Hi, thank you so much, Dr. Wilson. I'm Isaac Lenatok, Head of Value and Access for Novartis Philippines. So access is actually very close to the heart of Novartis because at least, the way we see it, even if you have the best medicine in certain therapeutic areas, if people don't get it, then there's no point. And at least for us, we see that only around 3 to 4% of Filipinos can actually access the medicines that we have in the country. So it's really a huge problem that we're looking at. So actually, for me, my question is specific to public-private partnerships for health. Because for the Philippines, actually, we know there are really movements in really going for universal healthcare. We passed the universal healthcare bill last 2019 before the pandemic. It's really one of the priorities of the government. We also know that there are increasing investments in our national health insurance system of PhilHealth. Budgets are increasing. Budgets for health are increasing at the local level. And we also know that public-private partnerships is not an unfamiliar term when we talk of, for example, the infrastructure industry. It seems that the elements are there, but partnerships in health is really something that I feel like it's still not very familiar for the government. And it feels like they are still afraid or not yet comfortable in going for something, a big partnership for with the private sector. So how do we push it to that tipping point that really, the private industry are able to partner with government for health and have a win-win partnership really for improved patient outcomes? Thank you.
That's a very, thank you. It's a very broad and insightful question. I would say the first is really around value. Clear definition of value. The second is aligned incentives. Clear understanding of the aligned incentives. And the third is really around leveraging synergies to drive exponential value. And the reason why I tend to think about it very simply is because that helps us get over the historical hump, which, regardless of country, has often set public in an adversarial relationship with private. That's really what we have to get over. And I think if we all focus on common purpose, understand our common definition of value for the person, align our incentives to meet that, and then look for opportunities to leverage synergies, I think it sets us all off in a good direction.
Please join me in thanking our guests this afternoon.
Thank you so much.
Before we wrap up, Doctor, I'd like to call one of my colleagues, Tricia, to present our gift to you.
So, Dr. Wilson, thank you so much. This is just a small token of everyone's appreciation for not just your participation and time today, but overall work and leadership in the field. So
Thank you so much.
No, thank you.
You have to explain the gift.
Yes. So this is, your regular goodie bag of Filipino delicacies. But we've also noticed that you have a small thing for brooches. Not to sound a little creepy, but we've noticed in all of your photos and videos, you have a brooch on your blazer. So we do have one for you with Philippine pearls, just so you can always carry us around with you. Thank you. Thank you so much.
Thank you very much.
Thank you. Last question. We can remain standing because hopefully this is short, Doctor. You talked about how from 10 years from now we could look back to today and look at the healthcare system, we won't recognize it. When you move forward 10 years, you will be looking back, I suspect not from UHG anymore. What do you think you'll be doing?
So interestingly enough, I think I might actually still be with UHG.
Okay.
Right? I know. It took me a lot of thinking to make that initial decision to join UnitedHealth Group in 2008. This has been my longest serving tenure with any company, any academic system. I firmly believe that if there is an enterprise that can help solve the problem of healthcare, it would be UnitedHealth Group. And so when I think about where I would be in 10 years, hopefully I will still be surrounded by UHG family, and together hopefully we would have helped move healthcare further than it is today.
Thank you very much. And your colleagues did not put me up to that question. Please join me in thanking the doctor.
Thank you so much.
Could I ask some of our members we'll take a photo, Doctor, if you can put that down. Ambassador Quisha, Dr. Alip, Eileen, could you join us, please? Ambassador, could you please join us?